The testosterone trap. What doctor? On a good reveals. Among men past the age of 40, statistics whisper a troubling truth. Nearly 40% already live with reduced testosterone. This silent decline does not merely touch desire or mood, it opens the door to grave conditions: heart disease, diabetes, osteoporosis, even premature death. Doctor. On a good, a urologist and pelvic surgeon brings the evidence to light. Her mission is clear: to show the hidden habits that rob men of vitality and the steps that may preserve both strength and longevity. But what everyday choices could shape something as primal as testosterone? Low testosterone, or hypogonadism, often arrives disguised. Fatigue that lingers without reason, a fog settling over the mind, shrinking muscle mass, a quiet erosion of motivation. Studies warn of deeper consequences: elevated risk of heart disease, creeping diabetes, brittle bones prone to fracture, and the ultimate measure, higher all-cause mortality. At age 45, the odds of deficiency reach 40%. By 80, almost half of men live with it. The scale is staggering. Yet the story is not one of despair, it is one of prevention. The question is simple: what should be avoided to protect this essential hormone? 1. The seduction of processed foods. The first culprit lies in the modern diet, shelves lined with refined sugars, bleached grains, and artificial fats. These hyperpalatable foods deceive the senses. They melt on the tongue, trigger dopamine surges, and invite endless consumption. But beneath the pleasure lurks harm. Blood sugar spikes, weight gain, and metabolic dysfunction emerge, each striking at testosterone. Instead of fueling virility, chips and cookies gnaw at it silently. Researchers have shown again and again, the more processed the plate, the weaker the hormonal flame. Could a simple apple or a handful of nuts truly tip the balance back? 2. The weight of metabolic syndrome. Beyond the pantry, the body itself can turn against its owner. Extra weight, diabetes, high blood pressure, and elevated cholesterol, collectively called metabolic syndrome, become silent thieves of testosterone. In one extensive study of men aged 40 to 79, those who lost just 10% of their body weight saw testosterone rise by 85 nanograms per deciliter. Such improvement is not trivial. It can mean the difference between sluggishness and vigor. The paradox is striking. Excess weight suppresses the very hormone that makes weight easier to manage. Does the spiral always descend, or can discipline break it? 3. The cost of lost sleep. Since the 1980s, sleep has eroded from the lives of adults, not only shorter in duration, but poorer in quality. Yet testosterone is bound tightly to rest. In a cohort of over 2,300 men, each missing hour of sleep dropped testosterone by 6 points. Another study placed healthy adults in controlled conditions, reducing nightly rest from 8 hours to 5, cut testosterone by 15%. Astonishingly, about 15% of working adults already live at this minimum, surviving but not thriving. 1 in 6 men carries the invisible tax of sleep deprivation. Could reclaiming the night also restore hormonal power? 4. The shadow of sleep apnea. The night holds another enemy: sleep apnea. Here, breathing halts repeatedly as the airway collapses, leaving the sleeper choking, gasping, or snoring thunderously. Partners often notice first. Thick neck circumference becomes a clue. Left untreated, testosterone plummets. Yet a study in 2016 delivered hope. Men with sleep apnea who began using PAP therapy saw testosterone leap by 222 nanograms per deciliter. The gain was dramatic, a reminder that behind the mask of rest lies renewal. How many men dismiss their snoring as trivial while their hormones collapse in silence? 5. The endurance trap. Cardio, running endless miles, or cycling through hours has long been praised as the heartbeat of health. Yet when performed in extremes, it may backfire. Long, punishing sessions raise cortisol, the stress hormone, which in turn lowers testosterone. Here lies a cruel irony. The pursuit of health can sabotage vitality. But balance tells another story. In a 12-week experiment, men who combined moderate aerobic training with calorie control increased testosterone by 25 points. And resistance training lifting weights, challenging large muscles proved even more potent. Could it be that strength, not endurance, guards the flame of manhood? 6. The power of heavy weights. Lifting to light sends no message to the body. To awaken testosterone, intensity is required, maximum effort, safely harnessed. Squats that burn the thighs, deadlifts that shake the core, presses that summon the chest and shoulders. These compound exercises awaken receptors across the body, demanding hormonal response. Without such challenge, the body drifts into complacency. Testosterone, like a general, rises only when battle calls. The question remains, how much potential strength lies dormant, waiting only for resistance great enough to summon it? 7. The hidden toll of stress. Modern life piles deadlines, long commutes, and multiple jobs onto weary shoulders. Cortisol surges under such weight, and testosterone falters. Evidence is abundant. In one study, male medical residents always on call, eternally stressed to show testosterone levels 250 nanograms per deciliter lower than hospital colleagues in calmer roles. Chronic stress acts like a slow acid, corroding not only mood but also hormonal integrity. If stress persists, vitality drains away. What would happen if mental health were valued as deeply as physical training? 8. The plastic threat, BPA. Not all dangers come from within. Some are hidden in bottles and containers. Bisphenol A, or BPA, a common chemical in plastics, infiltrates the bloodstream and disrupts endocrine balance. National survey data revealed a disturbing pattern. Adolescent boys with higher urinary BPA carried lower testosterone. The advice is clear: drink from glass or metal. Never microwave food in plastic. Search for BPA-free labels. A simple habit can shield delicate hormonal pathways. But how often do small conveniences mask lifelong costs? 9. The misstep of cutting healthy fats. In the quest to lose weight, many turn to extremely low-fat diets. Yet testosterone itself is born of cholesterol and supported by dietary fats. When fats disappear, so does hormonal stability. The Mediterranean diet, rich in vegetables, lean poultry, eggs, yogurt, olive oil, and nuts, has consistently shown benefits. Its balance nourishes not only the heart but the endocrine system. Remove fats entirely, and testosterone tumbles. Could it be that moderation, not deprivation, preserves both health and masculinity? 10. The culmination, a fragile balance. Each factor alone, diet, sleep, weight, stress, environment, nudges testosterone downward. Together, they form a storm. Yet the same elements, managed with care, can reverse decline. Clinical trials, statistics, and patient stories converge. Testosterone is not only chemistry, it is lifestyle. At 40, risk is high. At 80, it touches half of men. But vigilance transforms odds into opportunities. The message is not fear, but empowerment. Testosterone, often viewed as a symbol of masculinity, is in truth a measure of health, resilience, and longevity. Through simple but deliberate choices, cleaner foods, deeper rest, balanced training, stress relief, mindful avoidance of toxins, and the embrace of healthy fats, men preserve not only hormones but their future. Dr. On a Good's message resonates like a warning bell and a promise. Neglect these pillars, and decline accelerates. Protect them, and vitality remains within reach. So the final question lingers, unresolved but urgent. How many lives will seize the chance to guard this invisible force before it fades beyond repair?